Your health, your life. Expert insight that matters. This is Health Matters.
Welcome to Health Matters. I'm Nicole Taylor, the founder and board-certified nurse practitioner of Nikki LaMache Wellness, where we dive into all things health-related, including hormones, functional medicine, and aesthetics. But today, we have an exciting show. I'd love to introduce the Digestive Health Institute, Dr. Ross and Dr. Plaehn, to the show. And we're going to talk about a subject that has been everywhere in the news, and it's colon cancer. Maybe not the sexiest subject, but I think it's worth talking about. So my understanding, and please correct me if I'm wrong, that colonoscopy remains the gold standard. Is that true, doctor?
I certainly think that's true, and the evidence would go along with that. There are several techniques for colon cancer screening that are out now. There is the fecal occult blood testing with immunochemical measurement of hemoglobin in the blood or in the stool. That is a good starting point. There's the Cologuard test, the talking box that everyone has heard about. And there's now a blood test that's available for colon cancer screening. But all of those are screening tests. Colonoscopy is not just a screening test, but it's an actual colon cancer prevention test, because we can take out precancerous polyps that are the premalignant lesions, and as a result of that, we can take someone who might have been ticketed to get colon cancer and prevent it entirely.
Okay, well that makes sense. But now, what age, Dr. Plaehn, should somebody go in and start getting a colonoscopy? I mean, I'm 48. Am I behind the 8 ball over here?
Well, perhaps you are.
Oh, well.
It certainly depends on if you're what we call average risk, meaning you have no family history and no particular warning symptoms of bleeding or bowel habit changes or weight loss or any other blood abnormalities such as anemia. In those instances, if you were in this average risk category, we would recommend starting at age 45. Now, if you have a family history, then that changes the recommendations. We typically would recommend either 10 years earlier than the youngest first degree family member or age 40, whichever comes earliest.
Oh, okay. I had no idea that. So when we talk about those warning signs, those symptoms, what kind of symptoms am I looking for?
Well, in the first place, a lot of times when you get to the point of having symptoms, you could be in a world of hurt. Could be in a lot of trouble. So most people who have colon polyps and even advanced colon polyps do not have any symptoms at all. That's why the screening and doing your colonoscopy and the intervals Dr. Plaehn mentioned is important. But symptoms would include change in bowel habits. If you've had normal stools and they've suddenly gotten thinner, they've gotten liquidy, they've gotten harder. That's important. The other thing is rectal bleeding. Rectal bleeding is never normal and is certainly something that if it happens on any kind of frequency needs to be checked out.
Okay. So you're saying if we wait for these symptoms, what kind of danger are we posing to ourselves?
Well, I think the concern we would have is you may take a situation that may have been treatable to something that is more difficult to treat and or one that's going to require intervention, surgery, or perhaps even at worst you might need chemo and radiation therapy for a cancer if it's developed to that stage. Our hope is that we can identify people much sooner than that and or prevent from ever having to have that discussion with the patients.
Well, let's say somebody comes in and they get a diagnosis, or I should ask, how long does it take to diagnose them? You know, if they're coming in for testing, is this a long process, a short process?
It's a short process. Typically, when we're doing a colonoscopy, we can get pathology results often in 24 to 48 hours. But we also have roughly 60 years of experience between us at looking at these things, and we can talk to patients and their families after the procedure and tell them what we're likely to see on pathology. So you're going to get an unofficial but an immediate answer. And then the confirmatory testing we should be able to have back within 48 hours.
Oh, that's really quick. So once you get that confirmation, if it comes back and it is cancer, what does that treatment process look like?
Well, the next steps usually involve a multidisciplinary team involving a surgical team and an oncology team frequently. We have a very good referral network here in our area, here in Lansing, and so we're able to refer these patients to some excellent surgeons who are able to address the surgical needs and the response that needs to be undertaken, particularly staging with the surgery, with radiology such as CAT scans and other blood testing that will be used to follow these patients' progress and hopefully not have to have the discussion, but can help to predict recurrence likelihood.
Why do you think we're hearing so much now? Because every time I turn on the news, I'm hearing more about colon cancer. Is it on the rise or is it going lower? But why am I hearing about this?
Technically, over the last 25 years, the incidence of colon cancer has dropped, largely because of the screening and the procedures that we're able to do. But what we have seen, and I don't entirely know why, but we are seeing colon cancer in much younger aged people. I know Dr. Plaehn had 2 patients in the last few weeks, 40 years old, who had colon cancer. The youngest patient I've diagnosed with a rectal cancer was 21 years of age.
21?
So that's more evidence, even if you're younger and you have some of those symptoms we talked about, it's good to seek medical attention.
Oh, that's wild. That's so young. Do we know why exactly? Or you said that we don't, but what's the theories?
I think there's a lot of speculation at present, and it's a difficult situation to prove, but some of the discussions have centered around, does it have something to do with food? Does it have something to do with behavioral changes? Is there binge drinking that might be in a patient's background? Perhaps there might even be some discussion of exposure to a carcinogenic toxin-producing bacteria interacting with some of the foods and perhaps alcohol. But I don't think it's really well known why, but those are the areas of interest that are, I think, being researched, and hopefully we'll have some answers, because once we have those answers, perhaps we can intervene and prevent those from being part of the issue.
Cigarette smoking is also very strongly associated with colorectal cancer, and we don't know as of yet whether that's a nicotine effect or whether it's some other carcinogen. I bring that up because I'm not sure that we have enough information to say that vaping, for example, is any safer than smoking.
Well, and that was what came to mind when we're thinking about young people. I see more, at least in my clinic, I'm seeing more people that vape at a younger age as opposed to my older folks. What about, from a lifestyle perspective, what kind of advice would you give somebody to change in their life now?
I think part of it gets into a whole lifestyle assessment, and certainly financial burden maybe even play a role in that when we're suggesting some diet therapy and or lifestyle changes and modifying your diet. It's expensive for patients out there to go to the natural, organic, or more less ultra-processed foods. So that's ideally, I think, the way you would really want to go, is increase the amount of vegetables, fruit servings, things of that nature, but at the same time trying to reduce the ultra-processing that you might be exposed to. Also, reducing alcohol intake, avoiding tobacco. I think some of the common sense things that we've all been taught when we were growing up by our parents, certainly comes back to make sense.
Yeah, sometimes they were right.
I certainly think that the over-processing of food is an issue, but what we have definite data on is smoking, alcohol, and high-fat versus high-fiber diets. So the typical American diet is strongly associated with an increased incidence of colon polyps and colon cancer. A diet with 20 to 25 grams of fiber is associated with a reduced risk.
And can you give me some examples of high fiber foods people could add to their diets?
So I find cereals, whole grain cereals are an
Okay.
easy thing to do. We have diet guides, and I'm sure you do in your office, with how much fiber is in certain foods. I like to give those out and let the patients decide how they're going to build up the fiber.
I think it's surprising too. Some of the foods you expect are high in fiber may not have as much fiber as you might think. It might be more carbohydrate rich, but not necessarily fiber rich. So some of these diet guides that we have, and or the use of a dietitian or a nutritionist, I think is beneficial. But some of these guides really are pretty enlightening and surprising. Even when I thumb through them thinking I knew the answers, they are frequently enlightening to me.
My favorite example of that is I'll talk about high fiber diets, and all uniformly my patients will go, well, I eat like 5 salads a week. Well, lettuce has almost zero fiber. It's basically 2 strands of fiber holding together a bucket of water. And it's, so a lot of people are actually trying to get higher fiber content into their diet. They just don't know how to do it, and we're here to help with that.
Well, that's fair. I would have thought salads. I'm a little disappointed because now I'm going to have to read those guidelines that you guys have. Tell me something else that you would advise patients. We talked earlier about some fatty liver stuff. Any recommendations there?
In general, with the fatty liver, I think it applies to the colon cancer discussion as well, where diet seems to be a very big part of the cause and effect of some of the conditions that we deal with in our specialty. I'm sure in your specialty as well, and the patients that you see. So not only just diet, but I think exercise and good lifestyle choices always seem to make a difference and permeates all the different health issues that we're all struggling with in our practices as well as in other specialties.
Yeah, I agree with that. And when we talk about exercise, people tend to shut off immediately. You can almost see it in their face.
It's true.
I'm not talking about CrossFit or running marathons or things like that. Just getting out and walking on a regular basis. Feet pounding the pavement definitely has an effect on our bowel habits, making sure we're going regularly. And if there is something in our food, it makes sense that the faster you get it out, the better off you are. So just encouraging people to take a nice leisurely walk after dinner would be a big start over what a lot of our patients are doing.
No, I would agree with that. I think there's some data suggesting, better glycemic control perhaps when you are exercising shortly after a meal, and doesn't have to be an intense workout as just a walk out, a nice walk, 15, 20-minute walk after dinner or after a heavy meal might be all that you need to do to help encourage some good behavior and some good metabolism.
Yeah, those aren't huge, difficult, costly things to do, to go for a walk. I think that's really good advice. We were talking too about ultra processed foods. Can you give an explanation of what those are?
I think a lot of the unfortunately, some of the fast foods and some of the ultra prepared foods that we buy that are prepackaged and ready to serve, some of those may have some of these ultra processed chemicals, as opposed to some of the fresh fruits and vegetables you might get in the produce section. And I've heard people describe where you want to work your way from outside to in at the grocery store, where you get less processed in the outside of the store than the inside. I don't know how that applies to every store, but certainly a lot of the produce sections seem to be one of those areas that you might want to concentrate on.
Yeah, I agree. I usually tell my patients, if you don't have it on your shelf to cook with it, like polyethylene, some weird random name,
Right.
you probably shouldn't eat it.
Right.
An apple's an apple.
Yeah. Sadly, we've reached the point where the easier and cheaper the food is to get, probably the less health benefit it has.
Probably.
Yeah, I think there's struggles too financially for some patients too. So it's a struggle for us. You have to balance out the means that a patient might have, as well as their ability to obtain some of the foods that we would recommend. In a perfect world, sure, everybody should be eating that, but at the same time, they have to provide for their families, and or the time it takes to prepare is also something that's with lifestyle. It takes a while to prepare food, so you have to make that commitment depending on the needs and what your abilities to do it.
No, that's true. I want to touch on, there's a new liver ultrasound that we had spoke about, and if you can just touch on that one more time for our audience to understand that there's some other options out there for testing and things that maybe we haven't heard of and that's available.
Well, you're talking about elastography is the technical term for it.
I had to
but
Google
it's basically an ultrasound that measures the stiffness of the liver. The gold standard for assessing the liver has always been liver biopsy, which is a procedure where you pass a needle between the ribs into the liver and get tissue. You're sedated for that, but still it's invasive. There's risks involved, and you're getting a couple of pieces of liver about this long with maybe 5 or 6 hairs thick to evaluate the largest organ in the body. Our elastography machine uses ultrasound to assess the liver and can assess between 25 to 40% of the liver surface and give us a great idea of what stage any liver situation is at.
That's amazing.
It's
so exciting.
It's exciting.
It is, and I think it was important for people to understand that you guys cover a lot of different areas. You know, the colonoscopies to these liver ultrasounds, that there's a lot to be said. You don't need to sit home with symptoms, but you can seek out and get some good care.
We appreciate the opportunity to see these patients, but also it's really helpful that we can assess and what we can prevent going forward if we can give an accurate reflection of what's going on.
Well, thank you both. I'm Nicole with Nikki Lamage Wellness, and remember, small personal changes can lead to big changes in your health. Take care. Hi, this is Nicole from Nikki Lamage Wellness in Okemos, Michigan. I'm excited to bring Kyla Evans here today. She's a beauty expert. She's been in the field a long time. One of the things we offer in our clinic is Morpheus RF, but a lot of people don't know what Morpheus is. Would you explain to them what it is?
Of course. So Morpheus 8 is the most advanced radiofrequency microneedling technology that's out there. So we're combining both microneedling with radiofrequency.
And then by combining these two things, what does it do?
Yeah, so there's 2 things happening. So first, we're microneedling. So we're creating micro injuries, micro channels in the skin, waking up your body's natural healing response. And then we have the radio frequency, which is heat. So what that does is it also creates your body's natural healing response to wake up, produce more collagen, and also tighten the skin.
So what kind of results should somebody expect if they were to get a Morpheus treatment?
Yeah, so it can treat a variety of different skin concerns. Fine lines, wrinkles, acne scarring. If you feel like your pores are looking bigger, if you just want an overall glow. But one of the favorite kind of parts of this treatment for a lot of patients is the skin tightening that it can do.
I know I had it done, well, I did it to myself, and it really tightened up, and I was able to get rid of some of the fat.
Oh yeah, people love the jawline sculpting that Morpheus can offer, but you can do it on more than just your face and neck. You can also treat your body. You can treat the stubborn kind of tummy after having a baby, any of that crepey skin that you may have above your knees, on your arms. It's also great at treating stretch marks and scars.
Yeah, there's so many uses for this. It's one of my favorite treatments.
Yeah.
Thank you for being here today.
Of course.
Most people are familiar with braces. We like to treat patients with clear aligners. They're virtually invisible, a lot more comfortable, and they can shorten the treatment time by weeks to months.
Hi, I'm Nicole with Nikki Lamage Wellness, and I'm here with Dr. Hyatt from the Digestive Health Institute. So Dr. Hyatt, I have patients all the time coming in talking about GERD, but what is it exactly?
So GERD stands for gastroesophageal reflux disease. And what that involves is acid being produced in the stomach, coming up into the esophagus, and then causing distress or heartburn, in addition to some other potential symptoms. Typically more than a few times a week. At the point where it becomes kind of a problem.
And then, so if it's more than a few times a week, what are those symptoms that somebody's watching for?
So everybody knows about heartburn being a common symptom, which, obviously it's understandable what that might feel like. But it often can present in other ways. People can present with nausea. They can have hoarseness. Sometimes difficulty swallowing can be a common symptom.
So if they're having some of those symptoms, because I've certainly seen this with people coughing or the hoarseness, when is it time to seek help from the experts?
So I would say if you find that you are taking antacids more than a couple times a week, it would be time to go and talk to your family practitioner or your gastroenterologist for sort of deciding on next steps.
Okay, so more than a few times a week, they're treating at home, reach out to Digestive Health Institute?
Absolutely.
Okay, I love that for everybody. So remember, little changes can add up to big impacts on your health. Don't delay seeking out care. There's professionals that can help you.
Patients that have difficulty breathing through the nose should seek treatment when these symptoms are constant, don't get better, and they're struggling to breathe. We should all be able to breathe easily through our nose.
All right, I'm with Dr. Dirksen from Dirksen Dentistry today. And Dr. Dirksen, okay, let's talk about acids and sugars and how they affect our teeth. First, which one is worse?
They have a very similar effect. In combination, that's actually the worst. Acids will help the enamel essentially erode away, and then sugars actually feed bacteria so that they can create a home in your teeth.
Okay. What are some examples of acids that people might be ingesting?
So sodas, probably the most common, flavored coffees, Gatorade, even flavored waters, depending on what type you have. All of those can cause pretty significant problems.
So sad. I thought I was being a health nut drinking flavored water, but
yeah, not always the case.
Not good. And obviously sugar, we can all picture sugary substances.
Yep.
What are, so if somebody ingests these, should they brush their teeth right away afterwards, or what can they do to protect their teeth?
So the biggest thing in that situation is to not sip on something that's significantly acidic or has quite a few sugars in it. Have it with a meal, not in between meals. And then the biggest thing is especially with acidic environments, really don't brush right away. Wait about a half hour for the pH to rise above the level of which that enamel and decay can form, which is 5.5. But again, long story short, about a half hour after you have something like that.
Okay. So don't brush right away, but brush your teeth.
Yes, definitely.
Okay. And so what they should be drinking?
Yep. Water is probably the best thing, unfortunately. It's not as exciting, but it's the safest and best bet.
I knew you were going to say that.
Sorry.
Thank you for being here.
Thank you.
When it comes to your health, choosing the right care team matters. At the Urology Institute, you'll find experienced specialists who focus on personalized treatment plans tailored to your needs. We offer advanced technology, a full range of services in one place, and a team that works together to support you every step of the way. From diagnosis through treatment and beyond, our goal is simple: deliver high-quality care with compassion, convenience, and confidence you can trust.
I'm with Dr. Cardenas from the Cancer and Hematology Center. And osteoarthritis, you have a great, effective treatment that's painless, correct?
Yes.
Okay. How does this treat the osteoarthritis?
So it addresses the root cause of the disease, which is inflammation. So osteoarthritis is a disease of kind of unregulated inflammation, chronic inflammation, and the low dose radiation shifts the microenvironment of the affected joint from a inflammatory state to an anti-inflammatory state. And by doing so, it not only provides symptom relief, so reduces pain, improves functionality, but it also slows the progression of the disease by addressing the root cause, by addressing that inflammatory state and shifting it to an anti-inflammatory state.
And it's called low dose radiation therapy, correct?
Yes.
And you can do any joint, but it's specific for osteoarthritis.
Yes. So osteoarthritis. So, the autoimmune arthritis, rheumatoid arthritis, psoriatic arthritis, those are kind of a different mechanism in terms of the pathophysiology of the disease, and there just isn't the data for low-dose radiation for those diseases.
Okay.
Whereas for osteoarthritis, it's been used in various areas as a treatment for 100 years or more at this point.
So it's a proven treatment. It's been out there. It's painless. And I think you told me it takes about 20 minutes, but that's actually parking the car, coming in, doing it. And all they need to do is call the Cancer and Hematology Center or have their doctor give them a referral.
That's right.
Thank you, Doctor.
Dr. Ross, board-certified gastroenterologist with a health tip. Drink plenty of water for a healthy digestive system, which breaks down food so your body can absorb vital nutrients. Drink at least 8 glasses a day and protect your health.
All right, well, Dr. Sufyan, upper respiratory infections, a cold versus something else, how do I know, and are they all treated the same?
Yeah, a lot of times we'll have patients call us and say, can we get an antibiotic? I have this cold. And many times, I'd say at least 90% of them are viral, but there are some signs that you want to watch out for. If the cold or the upper respiratory infection lasts more than a week, if your symptoms get slightly better and then begin to get worse, those are all signs that you started off as a virus and it could be becoming a bacterial infection. Fevers after a week, or pressure and sinus complaints that are lasting more than 2 weeks, typically those are concerns that need to be evaluated and treated with an antibiotic.
So what I'm hearing you say, though, is that you don't automatically rush to an antibiotic with the first cough or blowing the nose.
Yeah, we tell patients, treat it like a cold the first week. Use your neti pot, saline irrigations. Try, some of that over-the-counter medications we talked about. And if symptoms are getting worse or just not getting better after a week or so, then we recommend being looked at.
Now, what if the patient says, I'm blowing my nose and it's green? Does that mean it's bacteria or not?
Not always, unfortunately. We have white blood cells that change the color of mucus. And so the color itself is not indicative of an infection.
So if it's not bacterial and it's virus, what can we take?
Flushing your nose out with saline is very helpful in a cold. Taking an antihistamine can also dry out some of that mucus to help with the cold symptoms. Pain reliever, such as over-the-counter pain medications, those are all helpful.
Perfect. Thank you.
You are welcome.
Life changes everything. Hormones shift, metabolism slows, muscle declines, and skin loses structure. At Nikki LaManche Wellness, we don't treat these as isolated problems, we treat the system. Through precision hormone optimization, metabolic weight loss strategies, IV nutrient therapy, red light sauna, and with the addition of InMode Quantum RF, we now stimulate deep collagen remodeling and targeted fat reduction without surgery. Aging well isn't about chasing youth, it's about restoring power.
Stay informed at healthmattersmi.com. Thanks for watching.